Yeah, thanks so much, Rob. As you mentioned, I'm Jockey Bali, and I'm really excited to welcome you guys here. We've got some great speakers for you guys today. In this talk, we're going to have Dr. Helen Levy, research professor, and Dr. Mengyao Hu, assistant research scientist, and Dr. Esther Friedman, research associate professor. And they're all going to discuss how their studies, specifically the health and retirement study in the case of Dr. Levy, the National Health and Aging Trends Study in the case of Dr. Hu, and the panel study on income dynamics in the case of Dr. Friedman. They're going to talk about how their studies have adapted to the COVID-19 pandemic. They will also outline measures used in each study, key findings so far, and what COVID-related data are or will be available in the future. So with that, and just in keeping things going as far as time, I'm going to turn things over to our first speaker, Dr. Helen Levy.
Thanks, John. I'm really happy to be here today, along with my colleagues, Mengyao and Esther. I'm going to share my screen. And hopefully you can all now see my slides. Speak up if you can't. Okay, thank you. So I'm going to talk about how the health and retirement study adapted our data collection in response to the pandemic. Let me start by providing just a couple minutes of background on the health and retirement study itself. So the health and retirement study is a longitudinal study of older Americans defined as over the age of 50. And it's been conducted since 1992. The first set of interviews were conducted in 1992. At any point in time, we have about 20,000 respondents to the survey, about half of whom are 65 and older, just ballpark, and about half of whom are 50 to 64 or younger than 65. Over the course of the study, we've interviewed about 40,000 distinct individuals because we enroll new cohorts as they age into eligibility for the study, new birth cohorts. And then of course, we follow people longitudinally until they die or refuse to talk to us any longer. So as we lose the older cohorts, we add younger ones. And that's why we've had over the course of the life of the study, we've had about twice as many people as we have at any point in time for our interviews. I'm going to use some terms I want to introduce now. We do what we call core interviews every 2 years. So 92, 94, 96, 98, et cetera. And we refer to those sets of interviews as waves. So we talk about the 92 wave, the 94 wave. And within each wave, the core interview refers to the main data collection that we do. And we do this with different modes. So we have a split sample design where half the sample is interviewed face-to-face and half is interviewed over the phone or on the web. And so people end up having a face-to-face interview if they stay in the study every 4 years. So you're sort of, the two halves of the sample are alternating with each other in these core waves. And in the core content that we collect, we ask in these every other year interviews about people's health. We ask about their work, since we want to observe people working and then over time as they age, exiting the labor force for retirement. We ask about economic status, both income and assets. We ask about family structure and caregiving. And we also have an extensive set of questions we ask about psychosocial well-being. And then in between these core data collections, we ask people other questions. So we send them surveys in the mail. We ask them to return on special topics, and that's going to come up for how we adapted in response to COVID. And then we also collect blood and saliva, and we measure things like hearing, grip strength, blood pressure, and gait speed. So we have timed walk. So we have a bunch of direct measurements from people in addition to the responses that they give us themselves in the surveys. We use the blood and saliva to process for biomarkers and also genetic information. And then finally, we have linkages to Social Security and Medicare data. So that's sort of a quick overview of the broad ecosystem of health and retirement study data. And then, okay, so what did we do in response to the pandemic? Well, first of all, just to frame the issue, as a longitudinal study, we've been collecting these measures on the different domains that we expect the pandemic to have affected, such as health, economic well-being, social, psychosocial well-being, caregiving, and family relationships. Sort of everything that we might have hypothesized would be affected by the pandemic. We were sort of collecting data on that already. So many of the impacts of the COVID-19 pandemic would be captured by HRS simply by keeping our longitudinal measures consistent. In addition to that, however, we also added some survey content to directly assess respondents' experiences of the pandemic. So I'm going to talk about those changes a little bit. And both of these approaches, you can sort of ask people, well, how did things change for you? And you can also just, for the measures that are consistent over time from before and after the pandemic, you can sort of just look at, well, did it change? Without asking them whether they think it changed. So we're going to be able to do both of those things in HRS. And I want to talk a little bit about that second type of measurement, sort of what we added to the HRS to try to capture directly people's perceptions of what was changing for them, how their lives were changing as a result of the pandemic. So in the 2020 wave, the 2020 set of core interviews, we added specific items on COVID, and I'm going to review those with you. And we also added questions to what we call the self-administered questionnaire, which is left behind with the respondents who have an in-person interview. We leave a booklet. Now, in 2020, we had to mail it to them because as I'll get to, the interviewers weren't actually visiting people in their homes during the pandemic. But in a normal interview year, this self-administered questionnaire is all about people's psychosocial well-being and is left behind. And we added questions to that as well as to the in-person and telephone interviews, all of which were conducted over the phone in 2020. And then in 22, we did a mail survey to follow up in 2021 about people's pandemic experiences. And we also made some smaller changes to the 2022 core survey and self-administered questionnaire. And then finally, we have COVID policies available as contextual data, different state policies. So I'm just going to say a little bit more about each of those categories of data that are available in the HRS to study the pandemic. So just in terms of timeline, we had been in the field, that is to say, actively conducting interviews for 11 days. In the 2020 wave, when all in-person interviewing was suspended because of the pandemic. And so we essentially had to adapt in real time. We adapted both by having all of our interviews shift to after a certain period when it became clear that we weren't going to get back out there for in-person interviewing. All of our interviews, including the ones that would normally have been face-to-face, were shifted to telephone. And we had this opportunity to add questions that most of the respondents would get about the pandemic. I think we had something like 5 interviews happen in the 11 days between March 2nd and March 13th. And our programming team that programs the, so we got together and we brainstormed what we wanted to ask about, and our programming team got it programmed in about 6 weeks. So we got a new instrument with COVID-specific questions in the field in early May. And we thought of this as the COVID module, because we kept the core questionnaire mostly the same, and then we added a bunch of COVID specific questions. And they were in the following 7 areas. So we sort of asked people about their direct experiences of COVID. Have you had it? Do you know someone who's had it? Do you know anyone who's died of it? We asked about how it had affected people's access to healthcare. We also asked if they had received economic impact payments that were being sent by the federal government in response to the pandemic. We asked how the COVID pandemic had affected living arrangements. Had they moved or had someone moved in with them because of the pandemic? How did it affect their caregiving arrangements? And then we also had something that we don't normally have in the core survey, just a completely open-ended question, allowing respondents to report on anything else they wanted to tell us about their experiences during the pandemic. To be honest, they're pretty exhausted by the end of the questionnaire. So we maybe got shorter answers there than a qualitative researcher might have hoped. But we did try asking that to make sure we weren't missing anything, because, at that time there was a huge amount of uncertainty about, what's important to people in this moment. So that's why we added that. We also added a bunch of questions in 2020 to the self-administered questionnaire. This is the one that focuses, this is the part of our survey that focuses on psychosocial content, and so we added questions about basically psychosocial things about the pandemic, like changes in how much social contact we were having, how activities were changed. We also added questions about work status, including who was an essential worker and whether they were able to stay home. So that's what we collected in the 2020 core survey. And then in 2021, we sent out a mailer, sort of mirroring these same topics, updated a little bit, because after all, events were unfolding in real time. So in the 2021 mailer survey, for example, we asked people about whether they'd gotten the vaccine and what their attitudes toward the vaccine were, which we hadn't asked about in the 2020 core, since the vaccine was not yet on the horizon when we were writing those questions. So we essentially, and we again had an open-ended, except this time it was a little more structured. What are the best and the worst things you've experienced because of the pandemic? We also asked people in the mail survey about their pets, since people enjoy being asked about their pets, and we wanted to have at least some positive things in this mail survey that we did in 2021. So in 2022, for the core survey, so we're back to the core in the even numbered years, we wanted to be able to track COVID, but we also wanted to return to our sort of steady state strategy of measuring things consistently over time, and allowing those data to form the basis of evaluations of what the impact of the pandemic was, rather than having special questions about how did the pandemic affect you. So what we did was we sort of took some of the content from what we had thought of as the COVID module in 2020, and we integrated it into the 2022 questionnaire in the places where it logically belonged. So for example, in the section where we ask about health and healthcare, we asked questions about, did you have COVID? And we asked things like, how did COVID, did you get a vaccine? Stuff like that. So have you had a vaccine? Have you had it? Did you have symptoms? We asked about whether COVID had disrupted their ability to get care. And then we also modified the interviews that are conducted with next of kin after the death of one of our respondents, which are sometimes referred to as exit interviews. We specifically asked whether COVID, whether the person who died had COVID at the time that they died, whether or not that was necessarily identified as the proximate cause of death. And then we also modified the psychosocial self-administered questionnaire to ask a bunch of questions that were about COVID, including new use of technology. Did people learn how to use Zoom so they could actually keep in touch with their grandchildren since they couldn't see them in person? Coping strategies, and again, more open-ended questions to try to get a complete picture in this area where, we never feel all-knowing, but we particularly didn't during the pandemic as we were trying to figure out what was going to be important to people. And then we have, as I believe the other studies do as well, a database that is available for researchers who have obtained permission to use our state level data through the restricted data enclave that we operate. We have a database of state level COVID policies that was collected by researchers at Boston University. And so if people are interested in looking at how different attitudes or behaviors or outcomes correlate with those policies over time, that research can be conducted in our restricted data enclave. In terms of results, I couldn't begin to summarize the work that people have done already using the HRS to look at the impacts of the pandemic. So I just have a few of the first studies that came out on this, but the HRS has already been used to study this question. And if you go to our online bibliography and you search COVID or pandemic, you'll pull up all of these studies that people have already done using the data to look at different types of outcomes. And I like this sort of scattering of papers because it shows the types of the breadth of topics you can look at using HRS to look at the impact of the pandemic. And of course, all our data are publicly available. Some are restricted, like the geographic identifiers, but a lot of them are publicly available for free on our website. And I'm going to stop there because I think we're taking questions at the end. Is that right? Or should we have questions now? John?
Yeah, so I think just for the sake of time, we're going to keep moving, but it looks like we might already have one question in the Q&A. So as we move on to the next speaker, Helen, if you wouldn't mind, keeping an eye on the chat or the Q&A. We can kind of answer questions as we go through the other two presentations as well. But thank you for that. With that, we will move on to our next speaker, who's going to be Dr. Mengyao Hu, who's going to be talking about the National Health and Aging Trends Study.
Thank you, John. Can everyone see my slides? Good. So thank you for inviting NHATS to this webinar. Today, I will be happy to be here to talk about NHATS COVID-19 collections. I also thought it might be good that I start with some introduction on NHATS, and then I will be talking about the COVID-19 related measures collected in NHATS. So NHATS is National Health and Aging Trends Study. The vision for NHATS is to build a platform for scientific inquiry to guide efforts to reduce disability, maximize functioning, and enhance quality of life of older adults in America. So NHATS, the first round of NHATS started in 2011. It's designed to support study of disability trends and dynamics in older people and aims to create the data infrastructure to enhance study of disablement at older ages and its consequences for individuals, families, and society. So NHATS is led by investigators at Johns Hopkins Bloomberg School of Public Health and the University of Michigan's Institute for Social Research with data collection collected by WestStat. And we also got input from interdisciplinary investigator team and multiple advisory groups. So the sample of NHATS is from Medicare beneficiary, and the study population is Medicare beneficiaries ages 65 or older. And NHATS uses a stratified three-stage sample design. We also oversample by age and race. So for those who are 80 and older and Black individuals, they were oversampled in NHATS. The field work, the first round started in 2011, and the sample size for the first round was over 8,000. And NHATS conducts periodic replenishment, which aims to create successive overlapping cohorts. So after, for example, in 2015, we did the first replenishment. The sample size is bumped up to over 8,000 in that year. Before COVID, NHATS conducts annual in-person, in-home interviews, and then I will talk about NHATS responses to COVID-19. So round 10 was conducted in 2020. So when the pandemic starts, in-person interaction was not allowed. So the interviews in that year was all conducted by telephone. And because of the telephone, because we transitioned from in-person interview to telephone interview that year, some of the performance assessments which require in-person administration by the interviewers were not administered. One exception was the clock drawing test. This test was initially conducted in person by interviewers. And because this test was used as a criteria for NHATS dementia classification, and the dementia classification in NHATS was used by many researchers and widely cited in publications. So we want to make sure that we can still provide consistent measures of dementia classification in NHATS. So in round 10, the clock drawing activity material was mailed to respondents and administered over the telephone. So in round 11, there's some uncertainty of whether in-person interview was allowed. So we were expecting changes, policy changes in that year. So we designed round 11 to be conducted in two parts. The first part included sections that could be conducted either by telephone or in person. And the second half consisted of performance activities that require a home visit. And in the data release, there are indicators to show that whether the first part was conducted in person or by telephone, and whether the second half was completed by respondents. And we also collected new data related to COVID-19 measures. And next, I will focus on what are the new COVID-19 collections collected in NHATS. So there are three types of new content collected in NHATS. The first one is open-ended COVID-19 question, which we added in round 10, the core interview. And the second one is following round 10, we did a COVID-19 supplement mail study in 2020. And the third one is we added new question items focusing on COVID-19 questions starting round 11 in the core interview. So I will first talk about the open-ended question. It was a question added during the 2020 interview. And this question basically asked respondents how COVID-19 has affected their lives. And so the question was placed at the top of the interview. So, and on average, we recorded their responses, and on average, they talk about 2 minutes. So they are really sharing their lives and experience during COVID. So responses to these items has been transcribed and is available in the NHATS restricted data repository. So for qualitative researchers, if you are interested, you can apply for this data. And next is the NHATS COVID-19 supplements mail study. So following the 2020 NHATS interview, we did 2 mail out, mail back COVID-19 surveys. And the first survey was sent to NHATS older adults participants, we call sample persons in NHATS. And the second survey was sent to family members and friends of NHATS older adults. The field work for this COVID-19 supplement mail study was conducted from late June 2020 through early March 2021. And the response rate for the SP survey, which are NHATS older adults participants, is 82%. And the response rate for the family member and friend survey is above 65%. So who are eligible for the COVID-19 mail study? So for the SP COVID-19 mail survey, NHATS participants who completed a sample person interview in round 10, they were all eligible for this COVID-19 meal study. And we have separate versions of questionnaires designed for sample persons and proxies. So if a proxy reported for NHATS participants in the core survey, we send the questionnaire to the proxy respondents. So as for the family member and friends, so at the end of the SP COVID-19 mail study, there's a section that we ask respondents that who helped you the most during the pandemic, and they were asked to provide up to 2 adults who helped them the most. So, and we identify those 2 adults and send the family member and friends mail survey to their family members and helpers and friends who help them. So there are some of the family members and friends, they are not eligible. They're paid aides, helpers providing services on behalf of the place SP lived, and those family members or friends who are younger than 18 years old. And all other family members and friends, they are eligible for the FF COVID-19 mail survey. So as for what content are included in the COVID-19 mail study, for the sample person survey, we started with questions regarding COVID-19. So for example, diagnosis, test, and symptoms, and the measures they were taken to limit spread of COVID-19. We also have a series of changes questions about changes in, for example, their living situation, their social activities, grocery shopping, whether they start doing online grocery shopping, and changes in healthcare, for example, whether they postpone their healthcare, and their coping behaviors, caregiving to others, financial difficulties, and a set of well-being questions. We also ask respondents help received with daily activities, whether there's any changes of help received and reasons for changes. As mentioned earlier, at the end of the questionnaire, they were asked to provide up to 2 family members or friends who helped most during the pandemic. And for the family and friends COVID-19 mail survey, most of the question items are parallel as the SP survey. So we also ask them about COVID-19 related questions on diagnosis, tests, symptoms, and measures they were taking to limit spread. And we also ask these changes questions, including like changes in contact with NHATS participants and their relationship with NHATS participants. And we also ask them their help in providing care to NHATS participants and whether that has changed during the pandemic and reasons for change of care to NHATS participants. And we also ask demographic items to this family member and friends. So the data files for the sample person files, those are public, and it takes a second to download the data, and we provide 2 data files. One is a tracker file, which includes all eligible SPs for the mail survey, and the other is the SP file, which includes their responses for those who complete the mail survey. And the family members and friends files, they are sensitive. It's very easy to apply. It takes about 2 days to get access. And we also include a tracker file and the data file for the family members and friends survey. So following the COVID-19 mail survey, starting in round 11, which was in 2021, we added COVID-19 related questions to the core NHATS core interview. So we added, for example, COVID-19 questions on diagnosis, tests, symptoms, and vaccination. And we also added questions on if the COVID-19 outbreak ever kept the SP from participating in valued activities, And we updated text to some of the existing questions and added new questions on activities regarding in-person or online. So for example, they visit family or friends, whether they do video calls, for questions on online shopping, and handling bills and banking online, and doctor's visits, whether they do it in person, online, or both, and religious services, clubs, classes, or other organized activities. So finally, I just want to highlight the recent publications using NHATS COVID-19 data. So on NHATS website, there's a page for bibliography, and we summarize all the papers using NHATS data. And as of June 2023, there are 43 papers published in 24 journals using COVID-19 data of NHATS. So this figure just summarizes the top research topics in these 43 papers. So 16 of them focus on social support or social networks. 11 of them focus on depression or anxiety, and some others focus on internet or online, caregiving, healthcare, dementia. So I will not go into all the list, but you can see that it's a wide range of research topics covered in these papers using COVID-19 data. And so on this slide, this is the bibliography website I just mentioned. You can go to the website and search for articles using NHATS. And this figure just summarizes the journals of the 43 papers which were published. So here is a list of journals with more than one publications using NHATS COVID-19 data. And the top one is the journals of gerontology. And there are also journals of applied gerontology and also, for example, JAMA internal medicine. So finally, I want to thank NIA for the funding support, and also I'm happy to take questions after all the presentations. And if you have questions, feel free to email nhatsdata@westat.com. Thank you.
Perfect. Well, thank you so much for that really nice overview of the work you guys have been doing since the start of the pandemic. And we're just going to keep chugging along here and go to our last but certainly not least speaker, Dr. Esther Friedman, who's going to be talking about the panel study on income dynamics and the work they've been doing since the start of the pandemic. So with that, I will turn it over to you, Dr. Friedman.
Oh, sorry about that. Just gonna share the screen again. Does that look right to you guys, or do you see the notes?
Still seeing the notes.
Still seeing the notes? Better?
Look, I'm still seeing the presenter view.
I'm not sure how to change it. I'm sorry. I had
okay.
everything. My computer has been rearranged since the last time I was in my office.
I think you can click the display settings on the top left.
Did that. I know we have limited time. I should have checked this with you before we started.
Well, I would suggest just go ahead like that.
Go
It's
ahead.
not too distracting. Yeah,
Okay.
that's fine.
One more time. No, I'm not seeing everything. All right, I'll go ahead with what I have here. I'm not seeing the notes, so something's going on here, but let's go ahead. In the interest of time, I'm going to be talking about the panel study of income dynamics. And mine's not working. My apologies. I just switched offices. All right, I'm just going to go with this. You might see more than you should, but you'll just get some of my notes in there. Okay, so I'm going to talk a little bit about the COVID-19. I'll try to keep it quick since I know I lost a little bit of time getting this set up. We'll talk about the COVID-19 measures in the PSID. So just first, I'm going to start with a little bit of background. The PSID started in 1968 with about 4,800 American families and a low-income oversample. It started out as an extension to the 1967 Survey of Economic Opportunity and was originally intended to be a 5-year study to measure poverty dynamics, but has continued on and has expanded beyond poverty and economic measures. There were annual interviews from 68 to 1997, and then we switched over to interviews every other year from 1997 to the present. And this is a household study, so with interviews of a household member, but we collect data on the family as a whole and individuals residing in a family unit. And I just did want to acknowledge the funders. The main funders of the study include NSF, NIA, and NACHD. So just a little more about the PSID. The original householders are followed until death or attrition, even if they move or enter separate households. So the study is longitudinal. We track people over time. The householders' adult children also become PSID respondents themselves when they move out of their parents' home and establish their own households. So there's this multi-generational component to the study as well. So we have information on parents, and then we have information on adult children when they leave the house and form their own families. And then there's periodic sample refreshment, including the immigrant sample refreshment, to keep it nationally representative. So the PSID today has 42 waves of data from 1968 until 21, which was our most recently available study. The data are actually publicly available through 2019, but 2021 will be released very soon. There is an early release already available on our website, and we expect the final release, I think, next week, within weeks. And PSID 2023 is in the field right now, and will be released, in a little while. But we're also gathering some data in 23 that I'll talk about. Overall, there are more than 11,000 original or descendant active family households in 2021. More than 100,000 individuals have ever been observed, and more than 80,000 variables are available. And as with the other studies, in addition to the data that we're collecting, one of the nice things about the PSID is that it can be linked to administrative data and other contextual data. So just to give you a sense of the kind of information we have in the core interview, as Helen mentioned, a lot of these are the kinds of things you want to look at to see how COVID might have affected these types of factors. So we have basic information on the household composition, on housing and utilities, expenditures, employment, different kinds of income, education, religion, and family background. These are the domains of information that have been collected for the most part since 1968, all the way through to the present day, with some changes over time, as you can see, it's indicated in this figure. Sometimes we gathered more information in earlier years, and then we started getting more information in more recent years. But these were the sort of core domains of the study. And then we frequently add other content, including content around COVID-19. So here you can see that in 1984, we added wealth information. We added information on the federal shutdown in 2019. And then starting in 2021, we added COVID information. So in addition to the core study, the PSID also has 2 supplemental studies, both of which also collected COVID information. So I wanted to mention them as well. One is the Child Development Supplement, or CDS, which started in 1997 and collected data about every 5 years. It continues to collect data about every 5 years. And that's a study of children who are from birth to age 17 and their families. These data are integrated into the core. So when CDS children grow up, they become PSID respondents. So you have this nice history of data on the CDS children. And there's a lot of information collected on children and their families, including achievement information on behaviors, health, family environment, and also on schooling environment. The other supplement is the Transition into Adulthood supplement, which started in 2005 and is collected every other year along with the core data. This is a study of young adults, ages 18 to 28. And the idea behind this was to fill the gap in information collected on children in the CDS and on the kind of main core respondents, so we can get more detail on the young adult years. So it has a lot of rich information that are relevant to those kind of young adult ages, such as transitions in schooling and work, family formation, transitions in life responsibilities and goals. So we've been collecting COVID data on all of those studies, the core and those two supplements. And the core data, we've been collecting information on our main reference person and a spouse partner, first in 2021, and then again 2023. That information, we know what we're gathering. It is being collected right now in the field. For TAS, we have similar information on these young adults being collected in 21. Plans for 2023 are still in progress. Should be out soon. We have the funding in hand and are ready to get going with TAS. And for the child development supplement, some of those data were collected in 2020. We've collected some COVID data on the primary caregiver and children, and in some cases other family members. That was fielded a little later, and actually, I should say, part of the CDS sample happened pre-COVID, and then part of it happened post-COVID, which was different than core, where we had a 2019 study and then a 2021 study. So we sort of skipped over the 2020, beginning of COVID. So CDS, we have it crossing 2020, 2021, and then we gathered we plan to gather some additional information in 2023 on the study in general and also on COVID. So I just wanted to briefly show some of the measures that we're collecting, first in our core study and then the supplements. So the kinds of things we've been collecting in core, in 2021, we gathered a lot of economic information on the economic effects of the pandemic. So whether individuals were laid off or furloughed, lost earnings, had to work from home. We gathered information on donations, stimulus payments, and paycheck protection. You can see a lot of this is similar to what HRS and other studies have been collecting, but we have it on sort of a broader age group here in the core. And then we collected general information on incidents, testing for COVID, and when people had COVID, if at all. That we collect in 21 and again in 23. And then vaccination information we started collecting in 23. We're also interested in these sort of, impacts of COVID on health. So we have a variety of questions on treatment and hospitalization. And of course, that gets updated in 23. We have more detail on new treatments that became available that were not available in 2021. And then in terms of symptom duration and severity, we have questions about whether people had any symptoms and how bad they were, and also whether there's anything lingering to capture longer COVID. So this gives us kind of short-term effects of COVID and long-term effects. In the Transition to Adulthood supplement, we've gathered information on economics as well, but it's geared towards these younger adults, so it's asked a little bit differently, but has questions about time off from work and earnings and savings and borrowing, questions about stimulus payments, and then other effects of the pandemic that are specific to this population, such as not currently enrolling in college due to the COVID pandemic, and then also information on vaccination and incidence. For the child development sample, there are a few different people who get questions. So there's a child, children are sort of the main population here, and they get some questions themselves and some questions asked of their parents that they report on behalf of the child. And then we also have questions for the primary caregiver themselves. And sometimes there are questions also about other eligible adults in the household. So that gives us information on the economic effects of the pandemic, on the primary caregiver and other eligible adults. We also learn about school closures and remote schooling for the children, academic and social activities of the children, relationship quality of the child. And then of course, things like vaccination, incidence, hospitalization, and symptoms are relevant both to adults and to children. So that's information that we have on all of them. As Helen mentioned, the PSID data can also be enhanced through geographic linkages, some of which are available through MICDA's Geographic Linkage Repository, OpenICPSR, other data sources as well. Most of these require restricted data use. So there is that, Helen already mentioned, the state database in COVID-19. There's other information in MICDA on state policies, some of which are relevant to COVID. Other COVID contextual linkages that aren't available yet, but are in the works, and that I'm not involved in, so I can't talk about it too much detail, but there are data that are being collected on risk exposure based on mobile phone data that I know some groups are working on that will be made available at some point, cases and deaths, and even COVID rates in local colleges. So you can merge geographic identifiers and figure out what the college situation looked like in different areas as well, and more. And then of course, many other contextual linkages can be used as well to understand the impact of COVID. How did crime rates change, pre and post pandemic, for instance, or access to healthcare. So just a couple more slides. I just wanted to say that with the PSID, there are a lot of topics that can be explored. Because our data aren't released yet for 21, there's some early data, but not the final data. There are a lot of things to come, but not quite as much yet as some of the other studies. But one of the very unique features of the PSID is that data collection was completed for the core CDS and TAS in 2019 and early 2020 before the pandemic struck. So there's this sort of pre-COVID baseline data for this entire sample of children, young adults, and adults into old age. And it can be used to look at the impact of the pandemic on a variety of outcomes across ages and generations. It can also be used to look at spillover effects on different members of the family or generations of the family, because we do have multiple family members. We have information on multiple people within a household, but also on generations across households. So this is a generational study. And you can look at the impact of, a parent or a grandparent, losing work or losing savings on other members of the family as well. And then there are life events and transitions across the life course that can be studied in the PSID, and one can look at the impact of COVID on transitions to college, work, first home ownership, and of course, variation in these effects, and things like financial security. And there's also, information on health and well-being, as I was saying, you can look at the experiences of COVID on long-term outcomes, and we also have information on lingering effects of COVID itself. So I just wanted to show you a little bit. We have preliminary, some of that early release data. If I have a couple of moments, I know I lost a lot of time, but I'm from New York, so I talk really fast. So hopefully I've made it up.
I think we're right at time, but if you want to just wrap things up on this slide, and
wrap it up. two more slides, but really fast. I wouldn't read too much into the specific percentages because this is based on early release data for a balanced sample of people in 2019 and 2021. But just to show you the kinds of economic information that we have in the study, about half of the PSID sample are essential workers. We have a fair amount of people who had to work from home during COVID, had financial difficulties. And among those who had financial difficulties, there were many different strategies that they took to deal with these financial difficulties. Many cut back on spending, used savings, had to put off paying bills, and even third to half used credit cards more, or got financial assistance from family members. So thinking about the impact of the different strategies employed and who has access to different strategies is going to be a very important topic to study with these data in the future. So I'm going to wrap up there, and we can turn to questions. And a lot of information is available on the website. Thank you.
Yeah, thank you so much, Esther. It was really, really nice, and I appreciate you wrapping it up right at the end there. I know you had some more important and interesting stuff to talk about. And again, I just want to thank all of our amazing speakers. I know there are a lot of you guys that have to move on to other things right now, but I believe we're able to stay on at least for another 10, 15 minutes to take any questions. Esther, it looks like you have one or two already in the Q&A. And then I think there might be another one in the chat. Rob, do you have anything that you would like to add?
No, that's perfect. In fact, I saw two in the Q&A and one in the chat as well. I want to thank all of our panelists and you, John, for organizing and arranging, and Cynthia Sopko also for arranging this panel. We are at time, but the panelists have indicated a willingness to stick around for a little bit to answer further questions if folks have any.
So I wonder if we just want to read some of the ones from the Q&A now that we're through with the presentations. So we have one from an anonymous attendee for Esther. Can you briefly talk about the similarities and differences in COVID-19 related survey items between PSID and the U.S. Census Household Pulse Survey?
That's a great question. I'm not sure. I'm not familiar enough with the Census Household Pulse Survey. I don't know if any of the other panelists are. I'm reluctant to get into similarities and differences when I don't know those items very well.
I can just put in a plug. We have started, we're in the process of creating a COVID-19 measures archive, which will involve variable level metadata, and actually incorporate with the social science variables database at, that ICPSR has, and certainly hope to incorporate metadata from like the Census Pulse Survey as well. And so hopefully down the line, you'll be able to very easily through our system go and compare measures across some of these key surveys. But I would also encourage you, the PSID and the Pulse surveys, they do have a lot of information online that's very accessible.
So there's also a question here in the chat. For PSID, are any of the CDS and TAS COVID data publicly available?
That's a good question. I think I know some of them are. I would suggest you go to the website and just see what's up there, because we've been updating it, as fast as we can. And one of the things we've been doing during COVID is putting early release data up there quickly. So there might be, so I'm not even sure what's up there right now.
All right, and then there's, I see we were responding in the Q&A, but let's just maybe one more, a generic question to the set. Did you collect any data on people's reported reaction, if any, to the vaccine? Anybody have that kind of data in their set?
If you mean like physical reactions, I don't think we did. We asked a lot of questions about how people felt about getting the vaccine, like why they did or didn't get it. And for us, that content is in the 2021 mail survey we did that is called Perspectives on the Pandemic.
That's in HRS, right?
Oh yeah, sorry, in the Health and Retirement.
Yeah, for NHATS, we also didn't collect data on reported physical reactions. We asked about whether they get vaccination, when did they get the vaccination, and if now, whether they plan to get vaccination.
We have similar questions to the NHATS, but yeah, nothing on reactions.
Looks like another question in the Q&A. I'm assuming this goes to everybody, so did you collect data on medication use?
So in the Health and Retirement study, we routinely, well, first of all, let me ask, was that, I don't know which study you want. I'll just tell you about HRS.
Yeah, I think it was directed at anybody, at all studies,
okay.
I think.
So, I mean,
yeah.
we ask a bunch of questions about what medications people use. And I think that we may have asked whether people who had COVID, no, I don't think we asked about, I mean, what do you, like things like monoclonal antibodies there, or do you mean like things like hydrochloroquine? We didn't ask about that. But we do ask generically about other types of medications that people take.
you want to go, Mengyao?
You can go first.
Okay, so yeah, I mean, if I'm understanding the question correctly, we asked about antiviral treatments, different kinds of treatments that people might have had, whether they needed, if they were hospitalized. We asked about ventilators or other, treatments that might happen in that hospital. So I don't know if that answers it.
Yeah,
And
so
I see, oh, sorry, go Mengyao.
sorry, I just want to say that I don't think NHATS ask questions about medication use related to COVID. We do ask questions about medical care. So like how to keep track of medication. So those types of questions and whether doctor provide help in that process.
Excellent. Okay, and I think this is our last one. It addresses to Esther. Could you briefly talk about the similarities and differences in COVID-19 related survey items between PSID and the US Census Household Pulse Survey?
Oh, I think we covered that one first, actually. So I think we're.
Oh, we did cover it. I'm very sorry then.
No, no worries.
In that case, it appears we have satiated the desire for, and I'll use that. Thank you, Janice, for the last question there. I'll use that as our close. So yes, this was recorded and the recording will be available later this summer on our ICPSR Summer Program YouTube channel. So thank you, everyone. And thank you again to the panelists, and have a good rest of your day.
Thank you.
Thank you.
Thanks, everyone.